Hello, and welcome to today's episode of the Scottsdale Living podcast. Today, I have an amazing guest, Dr. Tammy Penhollow, and she is a DO, and she owns Precision Regenerative Medicine. So, hi, Tammy. Thank you for coming on.
Hi, Amber. Thank you so much for the invite. I'm so excited to be here.
I've been thrilled about this interview since I met you, which was about 6 weeks ago. And so I wanted to tell people a little bit about the different kinds of doctors there are and what a DO is. Do you mind sharing?
Perfect.
Yeah.
So, doctor of osteopathic medicine versus medical doctor. However, the training in terms of equivalency, the ability to do any residency, neurosurgery, pain management, family medicine are all the same. But it was actually founded by an MD who was really exasperated. He's like, what is all this surgery and pills? And we're not really helping people get better. So I really believe that the body can heal itself if put in the right alignment. So when people hear alignment, they think, ooh, chiropractor, you mean you do cracking like chiropractors? And it's not necessarily. I mean, there is training, an additional 240 hours actually in musculoskeletal training during medical school. So a lot of hands-on diagnosis. And that really makes for a great doctor who can go active duty, because when you're deployed, you don't have a lot of tools, but you have your hands always, or to do family medicine. So a large percentage of DOs originally went into primary care, and now we do any specialty. So it's based on holistic approach, that it's not the knee over in 3 or the heart attack in 4, but it's Mr. Jones who has 3 kids and his wife's going through a hard time because she just lost her parents. So we're all under a lot of stress. So you really look at the whole thing before you just throw a label on something. So that's what I love about osteopathy.
That is fantastic. And it's a great synopsis so people can kind of understand, you really are a holistic provider. And a lot of people say that and they're talking about like kind of fluffy things. And what you're saying is I'm looking at the whole human and their situation and their environment before I'm helping them make a decision about why are you feeling this way? What is your primary complaint about, pain about? Because 99% of the time we're going into the doctor, it's because we're feeling pain or something. And otherwise we kind of ignore it. That's pretty typical of our country. And then you mentioned active duty. So I know that you have a military background. So thank you for your service. And you were in which branch?
I was active duty Navy for 12 years. I was actually on a Navy health profession scholarship. So, thank you for paying for my medical school to everybody. It was a 3-year scholarship and I owed 3 years for that, but I ended up staying 12 years because it just fit. And it afforded me the opportunity to serve all over the world and travel all over the world. And travel is another one of my major passions.
I love that. So tell us where you've been.
Okay. My very first assignment right out of internship was with a construction battalion based out of Port Hueneme, California. And we were forward deployed to Kosovo. Right after the NATO bombing, the construction battalion went in there to start rebuilding. So as a doc, I had 720 people that we took care of, and construction accidents happen, or trauma kind of management stuff, but a lot of musculoskeletal strain. So the osteopathy came in very useful. With them, I was also home ported in Port Hueneme, which is Ventura County. And then we went to Guam for 7 months as a peacetime normal deployment. I then started teaching our version of physician's assistants. They're called IDCs.
Oh, okay.
Independent Duty Corpsmen. And that was a 3-year gig in San Diego. And I taught even doctors and nurses and PAs and NPs advanced cardiac life support and basic life support. And so it was all about teaching. That's another big passion of mine. But from there, 9/11 hit. And I had been applying for dermatology residency because I thought, wow, how cool to do things like reconstructive flaps and a bunch of kind of surgical procedures, but also lifestyle. And I had to have a really, I don't know, I guess it's one of those aha moments. How am I going to treat these wounded warriors as a dermatologist? So I changed my residency applications to anesthesia, because I knew that at that point, that's what was needed, and acute pain was a big deal. So I went directly from there to National Naval Medical Center, Walter Reed National They were a combined program, Army, Navy, and we treated thousands of wounded warriors. We were getting 3 shipments, I guess you could say, 3 big planes landed every week. And unless the person had severe burns, then they went to Brooke Army Medical Center in San Antonio, but everybody else came to us. Sometimes
Walter
it'd just
Reed.
be a couple, or National Naval, Bethesda. So with that, I was able to do a lot of acute pain management. A lot of our patients would go into the operating room every other day for a washout of a wound. And
Wow.
for the acute pain service, we would sometimes place little numbing catheters. And that could just drip numbing medicine 24/7. And sometimes for the surgery, we didn't have to put breathing tubes in. We were able just to put something else in that would allow them to just dose that up with a really strong numbing medicine and let them have the surgery. They were still completely asleep, but without all that trauma of intubation every other day.
Yeah.
So that was
So
residency.
you worked with the most traumatic cases. I mean, I used to do wound care and it was nothing like that. They were not at level 1 hospitals and, it was completely different than that. Besides that, taking into account everything that you actually have experienced with your military career lends you to be able to provide something very special because you've seen what people actually go through. My whole family is military. My brother-in-law has been going through quite a bit of assessment for the things that he has had career injuries for as he's going on. And, the considerations for someone who's gone through, military battle and injury and trauma burns are terrifying, but also like incredibly nonstop painful. You literally can't get away from it. And then when it's not painful, it's becoming like irritating and itchy and literally all of the things that are annoying after it's less painful. And it takes just special consideration, special care, and then the right kind of providers around you to motivate you to continue to go because it can make you completely depressed that you're not able to, like looking down at your body, it may not look the same. It's just absolutely incredible. So thank you for doing the work that you have done and the work that you do now. We had thought before about starting a Scottsdale Living veterans group, and we haven't really launched it yet. And I think I briefly touched base with you on this. And I've been having more conversations. We actually just brought it up in a team meeting last night. Is that the reason that we haven't launched it is because we know that there are special considerations for our veterans, and we don't want to half-ass it. We don't want to half-ass it. We do feel like John's actually a veteran as well. And it just deserves a special amount of respect and the right kind of resources before you jump into something like that. We don't want to come up to a situation where we can't help someone that needs help in the appropriate way. We take that really seriously. And of course you do too. So, okay. So you worked at Walter Reed and then
from there, the Navy decided they would like to place somebody that had some additional pain training, not fellowship training, but pain training in Japan, in Okinawa, because we are spending a lot of money to evacuate patients from the Pacific all the way down to Tripler Army Medical Center or all the way to San Diego, depending on what branch they are in. So I did extra training at Johns Hopkins and some at the Mayo Clinic, Jacksonville, and just more rotations, and was sent to Okinawa for 2 years where I did anesthesia. Plus we opened up a little pain clinic. And it wasn't a big thing with all the accoutrements, but a lot of injections and some acupuncture. Did quite a bit of acupuncture there. And then in the middle of that, I was deployed to Djibouti in support of Operation Enduring Freedom and did 9 months there. And after that, I did a couple of years in Spain. It was like a dream tour. Typically, it's something that you get as a Navy captain or the equivalent of a Marine or colonel. But I did it at a senior 04 level and then put on 05 there. And it was the greatest farewell tour I could have. It's fabulous.
Wow. Oh, that's so cool. How beautiful too. Was? Oh, that's amazing. Okay. So retired from the Navy. And then what took you to your business now?
Sure. I separated. I didn't retire. I didn't do 20 years. So I'll say that. But I then got out and did a pain fellowship. because I knew that that was just the direction that I wanted to continue taking care of people. So I did a pain fellowship at Stanford. And from there, I purchased a practice in San Francisco. It was highly interventional, a lot of surgeries, implanting spinal cord stimulators and intrathecal drug pumps for people who've kind of failed everything.
Mm-hmm.
So I love being in the operating room. I love doing procedures. And I also knew that it wasn't enough just to do things like injections, or it wasn't enough to do meds. Just there was something more. Unfortunately, that practice did not thrive. I closed the practice and came back to Arizona. I'd actually done my 3rd and 4th year medical school rotations here, and I knew eventually
At AT still, right?
At AT Still in Kirksville, Missouri. And I knew eventually I'd come back to Arizona, and that seemed like the perfect opportunity. So from there, I did pain management, and I quit traditional pain management and went back to anesthesia. And then in 2019, I formed this practice, Precision Regenerative Medicine, because I'd been searching Regen Med. I think we'll talk about that, but and it was truly the answer, and it was the reason why I quit traditional pain.
Okay, so here we go. All right, we've both worked in the insurance world.
We have.
And I mean, I created my business because it was not satisfying. I couldn't practice the way I wanted to practice. I couldn't help people the way I needed to help them. And I was limited by this structure that said, oh, you can only bill for this. We want you as overly productive as possible. So basically, I didn't have time to care about my job. And I was a patient mill. That's how I felt. It was, I understand that healthcare is a business, just like any business. Businesses need to be able to generate revenue and profit to continue to go. And if you're not doing that, then you at some point have to like, okay, what are we doing here? But on the flip side, you have to be able to give something that is high quality and exactly what people need, not just what this closed loop system says that you have to provide. And this is where I love what you do, because you get into this caveat everybody's very aware of like the pain med cycle, and that a pill can fix everything. And now everybody's kind of hyper aware of it. But what do we do? What other options are there? And you already listed a few, but talk to me about that transition for you.
Sure. Well, it was to the point where I literally quit. I walked away. I could not see in good conscience a follow-up pain patient in 6 minutes. I cannot see a new patient who's been through this many things and has tried that many dozens of drugs in 20 minutes. And it wasn't right. It didn't sit well, and I wasn't serving them well. And then the options I had were more drugs upon more drugs upon more drugs, which caused side effects. And some of my patients were basically zombies, because it's either I'm in pain or I'm asleep. And the procedures that we were taught to do is steroid. Steroid destroys joints. Mm-hmm. Steroid causes so many side effects like weight gain and decreasing your immune system. And you can actually have tendon rupture if you inject into, etc., and burning nerves and all these things that don't work. And you're just eventually sending to the surgeon. And how many back surgeries are actually successful? How many knee surgeries are actually successful? We both see, maybe on a weird ratio, the failures. We don't typically see the successes, right?
Right. Because those people aren't coming back in, right. But the ones that we do see, like specifically like spinal fusion, like it actually, when I became a PT, it was the gold standard for surgeries for the spine, basically. So anybody that came in that had chronic pain for a really long time and pain while they're moving, let's fuse it. And we know that joints that don't move feel worse, but this was the answer at the time. And then what happens is typically after the fusion, so we're like putting a steel straw around a bicycle chain, and we're saying, every time it goes around, well, now the joint above and below have to move more because this segment doesn't flex. And we're just degenerating above and below. How long will that last? 3 to 10 years before you're in there again for the next one. And it's going up and it's going down. And we're just elongating this problem, correct, created by immobility, instead of what can we do to help this joint move more fluidly. And then chronic steroids. I mean, everybody that is on them feels great. And then once they get off, I mean, you can have crazy side effects if you're on them too long. I love that you mentioned, so when you look at an image, I think a lot of people don't know this, is when you look at an image of someone who has had 3 injections, can you tell the difference? Like a corticosteroid injection or steroids that you can inject into any joint. Can you see the difference in how quickly?
It's variable and it's somewhat controversial. So I will say that if you look at images of MRIs of the spine, pre and post ablations, for example, and oftentimes the steroids can go with, because you can put steroid and local anesthetic in the facet joints, and you can put steroid in the epidural space. After that, then you go to an ablation, anything that denervates or kills the nerve.
Burning the nerve off, kind of saying, nope, you can't send a signal anymore.
Stop sending that signal to the brain, so you kill it. But that nerve also goes to the muscles, so you can see atrophy or wasting of the muscles, and that makes you even weaker and less stable.
So basically, they're killing the signal that goes up to the brain and sends the signal for pain, and it's killing the signal that goes to the muscle to help it fire.
Correct.
Both directions are affected. And so when we don't think about that and people are getting serial ablations, they generally have that muscle wasting. Their muscles turn into kind of applesauce.
Yes.
They can't hold their own bodies up sometimes if they've had series of chronic and there aren't other things that they can go to. And it's this terrible battle between, oh, I'm in a lot of pain and I'm in pain every day. And what else can I do?
Correct. So I know that was kind of a weird answer for steroid, but steroids are involved often with that at the early stages. But yesterday I saw a patient and we've been working together for the past 3 months. He is an ultramarathoner. He's a triathlete and he needed to finish a marathon, and he started to get some plantar fascia pain, some on the bottom of the heel pain. And he had steroid that got him through to the end of the marathon. It was an acute fix. He was able to run, go do his thing. And then he came back to the same person after the marathon because he'd taken his couple weeks off and wanted to continue running. Huge pain, got another steroid injection, and something didn't quite feel right. Long story short, a rupture, partial rupture of the plantar fascia. And we're talking a 7-centimeter rupture.
Wow.
And now we're dealing with how do we bring that back together? It's not a complete rupture that's going to require surgery. Plus, does he want surgery in the first place? So he's undergoing some regenerative kind of treatment, which is shockwave therapy. And now he's ready. We've kind of reduced that from 7 centimeters to 3 centimeters. Now we're ready to use his own cells and inject it under ultrasound guidance into the plantar fascia, all of his growth factors and any inflammatory cytokines from his blood. And so we're going to use PRP in a couple weeks.
Very cool. I wanted to read something really quickly.
Okay.
Let me see. Okay. So this was a review that I found on Google of you. It's terrible. It's 5 stars. Okay. So I have had chronic back pain for over a decade. In the last couple years, it had severely impacted my mobility, strength, energy, and overall quality of life. As a former athlete in my early years, I thought my ability to live an active and athletic lifestyle had passed me by. After doing a great deal of research, my wife and I discovered Dr. Penhollow and her expertise in the area of regenerative medicine. She had the most complete approach on how to not only reduce the pain in my lumbar spine, but also has a very comprehensive program, which includes stem cell therapy as well. She was confident her approach would produce the results I was seeking. Now, he talks about specifics of the program, but then he says, her level of detail, caring, and passion for this area of medicine is something I have not encountered in all the years of dealing with this worsening condition. I have seen and spoken to well over a dozen doctors and specialists over the years, and none have been able to produce the positive impact I have seen under Dr. Penhollow's care. She personally calls, texts, and emails proactively. She is very responsive to any questions or concerns I have and has provided so many valuable resources for me to utilize to help me get the biggest impact to improve my back and overall quality of life. I simply cannot express how grateful I am for her and her care. There are good reviews and then there are excellent reviews that really speak to the soul of a provider and what they're really after. You've said nothing but that in this interview, but I just think that it really resonates with what you're saying, what you have done with your career, what you've done with your life to say, I want to do the best that I can to help people that are everyday people and people that have been through the most. How does that speak to you?
First, I'm humbled. I am also quick to say I did not do that by myself. He did the work. I gave him tools. He did have to work very hard. We put him through a detoxification diet. We strengthened his core. And he came in, he was religious about coming in and doing all the treatments. He did everything. He sacrificed the way he ate, the supplements he took, everything. And I basically took his then healthy body. We had optimized him, took his then healthy cells, and was able to do what I do by precisely putting them where they needed to go. But he did the work. I'm a facilitator, and I'm so thrilled for his progress, and he's done so well, and we keep in contact. And that's why I do what I do the way I do it. I couldn't do this in a traditional fashion, in a traditional pain management practice.
Well, I'm going to say that change that you made when you looked at 9/11 and said, how do I help, from dermatology to anesthesiology and pain management, was definitely the way that you're exactly where you're supposed to be.
Right.
That's fantastic. I love that. Okay. So tell me something about what is the hardest part of your job? What is the hardest part about what you do now? Or, maybe it's like something about the interaction, or what is the hardest part?
Challenging, but not overcomable, not overcomable is, that there's just so much misinformation out there, that there's so much re-education. But guess what? I'm a teacher.
Yeah.
I've taught and taught and taught for years. So I actually see it as a perfect challenge. Unfortunately, a lot of people are riding the wave of this wild, wild west of stem cell therapy. And I have to put those in quotes because you have to be really careful. FTC, FDA, all of these regulatory things, because they want to protect people from what I literally call scam cell clinics. And there are so many of those. So oftentimes I'll get people who say, yeah, but I had somebody who went down the street and they did blah, 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 and they're blah, blah, they get nothing. What do they use? Are they using a test tube full of blood, which is basically you're taking the red cells out and putting plasma back in? So fortunately, with the growth of the regenerative medicine space, we're starting to collect data. We're starting to get paper after paper after paper, and we're finally coming down with some protocols. This is the sweet spot for the number of platelets that you need, total numbers. This is the ideal concentration factor. This is the ideal interval. It's not a test tube once a week for 3 weeks at X number of dollars. We're trying to really rein that in. So I guess it's a problem, a challenge, but I don't think that it's going to be something that continues to be as big of a deal as we get more people in the field that are utilizing moral and ethical approaches to it.
Well, I love your idealism on that. I tend to think a little bit the opposite, is that the more that we go into the future, the more people are sometimes confused in the market, and the market becomes more confusing to them. And that's what sales is. And so finding those quality resources and quality products might get more confusing for a consumer, because consumerism says, well, this is the organic, healthy white bread. It's still Wonder Bread. You know what I mean? So we get more and more confused about, whatever the label on it is, because the wording got smarter. The wording changed. We're like, oh, wow, no artificial colors or dyes. And then you flip it over and you're like, well, aren't these all? It's fascinating sometimes. So, but I do love your optimism on that. And I think it does inspire me to okay, well, I need to kind of change my thinking on that. But the bottom line is consumers have to know that they can ask questions. So if I were a patient, I'm coming and I'm trying to find somebody to help me, what are good questions that I need to be able to ask my provider if I'm considering these higher level treatments, if I've had pain for a really long time, if I'm not finding answers? What are the kinds of questions I might be thinking that I need to ask a provider to see if they're a good fit for me, and to see if they really can help me or not?
How much time do we have?
As much as you want.
I'd want to know, what is your training? And I don't want to get into a massively controversial thing here, but being a fellowship trained physician, spine fellowship trained physician before anybody touches my spine is a big deal. I don't want somebody who took a weekend course.
So explain the differences between like certification courses and residencies and fellowships.
Sure.
That sometimes helps because people don't really understand the structure of those, the duration of those, and the intensity of those programs.
Okay. My training was 4 years of medical school, 4 years of internship and residency. During that time, I got quite a bit of interventional pain in addition to anesthesia, and then a year dedicated just to pain, whether that be interventions or the biopsychosocial, the physical therapy, occupational therapy, pain psychology, medication management, interventions, the whole holistic approach to it. Plus, not just taking the skills I had of driving a needle into a perfect target with guidance, but also knowing how to use this new technology, which is your body's own cells. I know it's not new that you don't have, your body's always had cells, but utilizing them, harnessing them. So that's then the details of what kind of subspecialty societies might you be in, or how involved are you in the data collection and publication and standards and those things. So you know that you're part of the society. And we now say it's not one injection every week or every month for 3 months. That protocol. It's not a protocol. We don't need to do that anymore. If you use the right number, the right kit in the first place and get the right number of cells and precisely deliver it, then maybe one is all you need. So I guess that's the difference in terms of versus a weekend course. You don't have fellowship training, you don't have a residency training, and you may not even be a physician.
That's a great place to start asking about qualifications.
Yes.
Again, there are a lot of people out there doing a lot of different things right now. And I think that it does get confusing for patients, for any consumer to try to find that information out, because there are 20 people that are not necessarily as qualified doing similar procedures, and people think that they're the same, or the cost point is a little bit lower. And so they're willing to risk, and they don't even really realize it's a risk. They're just looking at cost.
Right.
So yeah, kind of interviewing somebody a little bit, or at least doing your due diligence of looking up what their credentialing is. And they should have some of that information, like fellowship stuff, right there on their website or listed in their About Me for their staff. Some places it is harder to find that. So like hospital systems, you may not find all of that info. They kind of just list the credentials and what department they're in, and head of neurology or whatever it is.
Right.
So they may not have all of that in there. But if you are going to a more private provider, they should have most of that listed for you. And then you're more than welcome to ask that. I think people are really afraid to ask those normal consumer questions. But if I was going to buy a car, and a lot of medical procedures are about that expensive, I would want to ask. I would want to ask more information about what the quality of the outcome is probably going to be.
Do you have data to back claims? And that's another thing right now, that there are nationwide data registries, and it doesn't cost a lot to be in part of that. And it's taking samples from every single patient and getting a pre-injection count of the platelets, a platelet-rich plasma count, or in bone marrow derived stem cells, then sending a tiny sample of that aliquot to a lab and letting them grow them. You get the results after the fact. It's not like we know ahead of time, but the quality of the aspirations. You know how the technique of collecting it, and then how they super concentrated it. So you can extrapolate and say the total number of cultured fibroblasts per unit is the equivalent of actual stem cells. And we know that the numbers are, the goal is 1 to 2 billion. Or in platelet-rich plasma, you know that the goal is 10 billion. And if you're using a test tube, you simply can't get that. So that's important too. Are you collecting data? What are your outcomes? Do you have a data registry? can, not necessarily can I talk to a person who's had it done, because that's a HIPAA privacy issue, but can you show based on pain scores and these standardized things for knee? There's a KOOS, for example. And it's standardized across many, many languages in multiple countries. And you can see pre-injection, at the time of injection, 2 months, 6 months, 1 year after. And it's a quality of life improvement measure.
Wow.
And you can show those kind of things. Pick a joint or pick the spine or the neck. They've got all of these things. And
now
neck
I'm like,
disability.
can you please poke me in the knee? I hate needles. Or I'm like, can you test mine? That's super cool. So like a fountain of youth measure.
Yeah. I mean, what is it ultimately that you want the pain score to be 0, or is it ultimately that you want to play on the ground with your kids or grandkids? 100%. Is it that you want to go on this dream vacation where you can walk on uneven streets? You can actually walk the golf course rather than ride the golf course. What is your goal? So that's the conversation you have. And I would hope that you would have that with whoever you're sitting down with to see if they're the right fit for you, is they ask you, where do you want to be? What is your destination? And let's see if I can help get you there by harnessing your body's own cells in this case. What's it going to take to do that? Because it's going to take us co-laboring. It's going to take us partnering, because I can't do it. I can't take magic and take inflamed cells and put them into an inflamed joint and expect good outcomes.
Right.
So that's another thing is seeing if they're selling a magic pill, which that we all know that there is no such thing, or are they saying that let's work together to get you to where you want to be?
Yeah.
Those are some of the harder questions that I'd ask.
So you obviously also are interviewing the patient about how dedicated and educating them. Hey, this is going to take some work on your part. This is really what we have to accomplish with this. And sometimes that's basically it's expectation setting.
Correct.
So you're setting that expectation. Hey, this is what we need to accomplish. And if we do that, then this outcome from the procedure that we want to get to is more likely to be effective, and you will be more satisfied with it. And let's make sure that if you're spending that money, that you're getting the actual result that you want.
Correct.
I love all of that. And I mean, I do that a lot in therapy, but when somebody's paying a healthy amount, because all of these kinds of injections are not inexpensive. So once they get to that point, how do you know when they're really there? Are you doing a test to test them? Like an inflammatory marker test? Is it just a blood test?
Before we collect the cells? Oh, it's a combination of, sometimes it is a full detoxification so that we know that we've gotten them onto an anti-inflammatory diet. They've changed some things, that we've been off alcohol, for example, a certain number of days, that there's certainly been no non-steroidal anti-inflammatories, because those poison the platelets, and with the platelets go the growth factors, and therefore you are basically not injecting effective cells. So once you meet all those things, we'll often do baseline labs. And I've got an anti-inflammatory panel. If it's a diabetic patient, we've got to have that hemoglobin A1C under well control. So we've optimized there again, because it's so pro-inflammatory. So there's a lot of different things. It's so individual. I can't give you a single answer, but it's variable per patient, but rarely will you come in and say, I want the consultation and the injection on the same day. That doesn't work, right? Because I don't even know if you're a candidate, and I don't even know that you're ready at this point, or if you'll ever be ready. So we don't do that. I don't think it's right medicine. So
that could be one of those red flag markers.
For sure.
For somebody walking in, oh yeah, we'll get you in this afternoon for that, when they have no information to collect for you about what your system is.
But I want it now.
Right.
Right. And so we are that now kind of society. And I appreciate that. There's sometimes that I have to pump the brakes on my own expectations of patients when I'm dealing with something. Patients, not patients, but my own patients issues. So I get that, but I also know that really good outcomes come when everything's optimized.
That's fantastic. Okay, so you've been practicing for over 20 years. You're loving your business. What's next? How do you see your business growing, developing? What do you want from it? How do you want to help the community? Tell me a little bit there.
My big, hairy, audacious dream, that BHAG thing that people talk about, goals. Ideally, I'd love to have a holistic healing center. I'd love to have almost a co-op. So I'm not everybody's boss, but I'd love to be able to have under one roof a healing center. And a person maybe even comes in with a like a little tracker. Here's your little bracelet for the day. And I know that you're stopping here at the juice bar. Then you're going to go in for your massage. Then we're going to do some light therapy. Then we're going to do some shockwave therapy. Then you'll come up to this center for a XYZ, whatever. I mean, that kind of thing under one roof would just be amazing. And to be able to collaborate with all these people that are of like mind would be fabulous. And patients would feel like they are at the center. We are tracking them. We know exactly where they're at. We know that we're all about taking them that day and allowing them to achieve their dreams. So that would be ideal. Right now I'm solo. So the next probably baby step would be having somebody that can help from a team management side of being there to answer the phone when I'm in the operating room, because I still do anesthesia, to be able to help coordinate some things and follow up with some of the 2, 6, and 12-month surveys and just kind of growing that way. I'd love to add shockwave. I don't personally have it at this point. It's not an inexpensive therapy, but I think it's 1 + 1 = 4 when you talk about it plus orthobiologics. So that's also on the short list of being able to do that. It also helps athletes and people in season, where with platelet-rich plasma or bone marrow derived cells, you need to take some time off. And if you're in the middle of, I've got a huge golf tournament next week, that's not the answer. It maybe shockwave is until we can get to the point where you can have some downtime of about 2 months. So I think that that's a really, really good adjunct.
I love that. You're like making me think of some people that work together. Dr. Chris Spencer is a chiropractor, Kristen Kaufman from Moz Pause Massage, and they actually have a collective, and I could easily see you fitting into just like the mental alignment of really truly wanting to help people. And they've started creating something like that, but it hasn't included medicine yet. And I don't see a lot of practices that are doing that yet. It's not truly holistic.
Right.
I can definitely see you doing that. Okay. So your big, scary, hairy dream. I love it. Thanks for sharing that.
Well, thank you.
Is there anything else that you want to share? How do people find you? How do they connect? Where do they go?
At Precision Regen Med is Instagram, Precision Regenerative Medicine on Facebook, or the website. It's https precisionmedprp.com. And on there, you can link to a bunch of videos that I've done. Again, education is crucial for me. So I've shot a bunch of videos and I have that link to YouTube. So I think basically social is the way to go, or the phone, and just know that I'm answering phones right now. So if I am with a patient in a procedure, you may go to voicemail initially, but leave a message and I'll call you right back. Literally, It's me. So you get me.
Oh, well, high five for small businesses. I'm there too. Yeah, I love it. Well, you are absolutely inspiring. I want to say thank you for your service again. I love hearing about your work experience and how you really are transforming the area of pain management and truly serving the patient. So thank you, thank you, thank you. This has been a fantastic interview, and I'm sure we'll have you on again.
Thank you so much. I've enjoyed this.
Thank you. And that's been today's episode of the Scottsdale Living podcast.